Good morning, everyone. Welcome to our keynote session for the CADRE 2022 Symposium. We're going to get underway this morning with a moment of silence in recognition for the community of Uvalde, Texas. Let's just take a moment. Okay, welcome back, and thank you for joining us for the second in our series of sessions today, the fourth in our series of CADRE 2022 Symposium, A Day in the Life. By way of welcome and introductions, we are really pleased to have joining us for today ASL interpreters that should be spotlighted in your screen for this session. If you would help us by beginning to enter your name and organization into the chat so we can get to know who's here with us this morning. And what we have up here is we have two interpreters that will be running with us. We thank Rick and Sheila. Well, you'll see Sheila in just a moment. We'll be sharing the sign language interpretation responsibilities for today. They join us from Partners in Communication, and we thank them for their support. Also continuing on, our other accommodations for today's session, we are running, as with all of our sessions, Zoom and Otter AI live transcription. I will serve as your access and technical assistance coordinator for the session. I should be at the top of your participants window. Feel free to private chat me if you have any questions or need assistance. We are recording today's program, both for those who need or request it for note-taking purposes, and we will be posting it to our website under our preparedness tab for this year's symposium. We do ask that if you speak aloud as a part of today's program, that you please turn your camera on when you're speaking to also help facilitate communication in today's program. And with that, I think I'm going to turn it over to Marcia for our next slide.
But first, a word from our sponsor. All right, let's see. All right, I will be very brief because I think most of you have already seen this. There is a new app called the MyShake App. It's an early warning for earthquakes. What it does is detect the sound waves from earthquakes coming and gives you a few seconds of warning that the ground is about to shake, which gives you a little bit of time to get to safety. On the screen are QR codes. If you want to take your phone and capture that with your camera, you can scan it and it will take you directly to that app so that you can download it and know when the next earthquake's coming.
Earthquake. Drop cover, hold on. Shaking expected. Earthquake. Drop cover, hold on. Shaking expected.
And that's what it sounds like. It's only announced in English, so that's why we need to educate people ahead of time to download it and know what the picture looks like and what the sound is so that they don't need to know exactly what it says. And then this next slide is just showing you that CADRE, through a grant with the United Way, is going to be conducting from now to the end of the year earthquake safety trainings for the home. They will be in person on Zoom, and then they'll also be recorded on the CADRE website. If you would like to have a presentation, schedule one, you can email earthquake@cadre These are just pictures from the show that walk individuals through taking care of their home and their family and what they need to do to make good decisions after an earthquake. This will be presented in at least 7 languages, and if you would like to be involved with the translated versions, either to help as a presenter or help translate, we're hiring right now. And that's the end of my... So let's go on with the next slide. Awesome. So today we're here. I'm very excited because we have June Isaacson Kailes with us, and I wouldn't say it's hard to get her, but for some reason we've never had her talk with us before, and I think that's been a missed opportunity. So I'm really excited today to listen to her tons of experience about what to do before, during, and after disasters to make sure that we have a good user experience for everyone in our community. You will be asked to put questions in the chat, and we'll be monitoring the chat and try to get to as many questions as we can. And then hopefully our goal is that you'll be inspired by what she has to say, and that we can use her as a resource as we go forward to trying to work through the things that we don't have in place yet. Next slide. And I'm going to turn it over to Sherry Burns.
Okay, thank you so much, Marcia. And it is my distinct pleasure this morning to introduce June Isaacson Kailes. June is well known for her pioneering work in disaster management. She was part of less than a handful of people with disabilities who focused on emergency issues decades before Hurricane Katrina, which is when I first met June. However, as far back as the 1970s and 1980s, June documented the profound and dramatic lack of equal and inclusionary emergency services for people with disabilities. She has worked nationally with FEMA, the Centers for Disease Control, the Department of Homeland Security, and Health and Human Services on policy, planning, and training issues. Besides her prolific research and writings, June developed 2 nationally recognized strategies for developing emergency plans and responses based on optimizing a person's function rather than quote unquote special needs. One is CMIST, which stands for Communication, Maintaining Health, Independence, Support Safety and Self-Determination, and Transportation, which I spoke about yesterday, and we've been utilizing as the strategy for discussing some of our scenarios that we've been going through the last 2 days. The other is Functional Assessment Service Teams, or FAST. FAST teams strategically link government, disability-led and disability-focused organizations, and business sectors to work with individuals with access and functional needs to help people maintain mobility, health, safety, and independence during and after emergencies. FAST blends the competencies and skill sets of governments with community disability service workers. In emergencies, people with disabilities continue to lose their health, independence, and sometimes their lives because lessons observed, relayed, and documented are not integrated into plans, policies, procedures, training, and exercises. June's work, however, focuses on consistently and repeatedly applying these lessons to be eventually claimed as real lessons learned. Thank you so much, June, for joining us today, and we are looking forward to learning more from you in our quest to integrate lessons learned into every aspect of our disaster services activities. Take it away, June.
Okay, hey, thanks, Sherry. And I am talking to you from Monterey, California, and that's just, let's see my geography, that's just north of you or south of you? Well, it depends where you all are, I guess, but yeah.
Just
so
south of us.
I am ending a vacation in a few days, so I know all of you are Zoom natives by now, given the last 2 years. So if you see unrelated activity of people packing their suitcase in the background, just kind of know that's the typical common Zoom background interruption. So bear with us. And the sound check, Sherry, sound is okay?
Perfect. Thank
Great.
you.
So today, I want to keep it a little informal. So don't be shy if you have comments or better yet, questions. Put them in chat and people will let me know they're there and we will get to them. So feel free to make your questions known and I'll appreciate that. So today we're going to focus on the lessons learned depend on repeatedly applying the lesson details to really strengthen our support of people with access and functional needs and people with disabilities in emergency planning, response, and recovery. So now slide 2. One slide backward. As Sherry said, I'm based in LA. I have a full-time consulting practice for well over 3.5 decades. I work with both health and emergency systems. And my focus is converting the laws, the regulations into really actionable and sustainable practices that prevent civil rights violations, close service gaps, remove barriers, inequities, and disparities, and really operationalize the details that make services, physical sites, equipment, and communication accessible. So today I want to cover, next slide, slide 3, health plans as a resource in a recent report that you all can use in terms of integrating CMIS. CMIS lessons to apply, core lessons, your support roles, emergency communication accessibility and content, modernizing training and meaningful measures. Now, there are more slides than I may get to, but they are there for your reference and they will be posted as a PDF. Slide 4. And I've got Sherry, Anna helping me with the slides because my laptop here is very tiny. I'm used to having more of my tools on my desktop, so I feel kind of constrained by a very tiny laptop. I hope I'm not too dark in the picture frame. My content today integrates work that I did last year on this report, Health Plan Member Focused Emergency Practices Roadmap. They were lessons from COVID as well as many other disasters. And that report is available at the link below. So if any of you know or work with health plans, please pass this report along. And there are also some accompanying slides related to the report. So I'm gonna give you a surprise quiz, slide 5. Don't get nervous here, but it's a surprise quiz. So think about this. Which is not true of health plans? That they touch and serve more people with disabilities than any other service system. That in emergencies, they're often under-recognized and underutilized. And C, that they're an essential partner with many needed resources and capabilities. So think to yourself, which ones of those are true? And just a raise of hands, and you can find your hand raised under reactions. How many of you think they're all true? And Anna, you'll have to give you the visual because I can't see it on this tiny laptop.
We're seeing a number of hands and thumbs raised. So,
Okay, well, you guys are on top of your game. They are all true. And the message is to really start inviting health plans to your planning, response, and recovery meetings because they are critical partners. And in this roadmap, it really doesn't exempt any of us, any of you, from developing and implementing emergency practices for people with access and functional needs, for people we support, and for ourselves. And the roadmap has a lot of details that all of us can use. So I urge you to use the details in the report. Next slide. So our player bench is pretty darn slim and thin when it comes to access and functional needs. We really need to look at this in terms of the CMIS focus and physical equipment, programmatic, and communication access. This content today, and probably for all your 3 days, works to deepen and strengthen this bench and you, the team, and to convert some of the rhetoric of whole community and cooperation, collaboration, communication, and coordination to more specific, what I call the 5 W's and the H, the who, what, where, when, why, and how to make it work and make it real. So you probably have heard this one before, but it's always worth reviewing and restating. Next slide. There was an important job to be done, and everybody was sure somebody would do it. Anybody could have done it, but nobody did it. Somebody got angry about that because it was everybody's job. Everybody thought anybody could do it, but nobody realized that everybody wouldn't do it. It ended up everybody blamed somebody when nobody did what anybody could have done. So the message, no responsibility shifting and no who should. The bottom line is we all should. So today, start listening with your lens in terms of your responsibilities and your focus, your roles as people with disabilities, as advocates, as emergency managers, as disability-led organizations or disability-focused organizations, public health people, and anyone else I have missed in terms of your responsibilities and your roles. So your task should be really to, if you choose to really make your next action accountability and takeaway list. What will you work at in terms of embedding and sustaining? So one memory tool I like to use, I've started to use in my own note-taking is, what will you start? What will you stop? What will you continue? And what will you change? So that's kind of for your little those of you who are note takers, that's how you can annotate your own notes. Next slide. So we all live with endless constraints. So here's another quiz question. Which of these constraints are not common? 1, constant organizational shifting of workload priorities. 2, priority overload, narrow bandwidth and full plates. 3, shrinking budgets and staff. 4, today's champions are often gone tomorrow. And 5, memories degrade, erode, and are undependable. So, which of these constraints are not common? You can, any of you who dare to, just put your answers in chat. Anna, anything there?
This is Marcia. Sherry says they're all common.
Figure Sherry would say that. Okay, any other responses?
I have 3 more saying all common.
Okay, well, I just can't seem to trick any of you today, but you're right. It's a trick question. They are all common, especially the memory one. How many times have we heard, now, how did we do that back then? What did we do? So next slide. So shift always happens. We live with endless constraints. Next slide. Yep. It's really the ultimate challenge is keeping disability and access and functional needs inclusion on the front burner. Next slide. To prevent the siloing, which goes like this. Oh, Sherry will take care of that, or Adam will take care of that, or June will take care of that. So, or, you know, we all need to really be partners in this and be ready to deal with what gets in the way to break down those silos. What gets in the way? We can't do it. We don't have enough staff, time, or funding. We won't do it. We have no way to enforce this. No one will check. Or we don't know how or what to do. Next slide. So you as emergency people interested in emergencies hopefully know this, but we have to guard against us and others falling victim to the fade factor. And there's a picture here of a person walking railroad tracks and fading away in the distance. So the fade factor is the typical human emergency cycle, a short-lasting burst of passionate advocacy and renewed vigilance to prepare for the next time, followed by the rapid melting away as time passes and other priorities compete for time, attention, resources, and budgets. Next slide. So is this true or false? We must never assume our past success will be integrated and deployed in the future unless we embed concrete change. How many think that's true?
June, we're seeing some thumbs up in emoji screens or check marks. Marcia in the chat.
Good. Well, it is true because we must never assume that our past successes will be integrated or deployed in the future unless we embed them. It's a difficult and a disturbing lesson. At least it has been for me. Next slide. So, it's always hard for me to pass by wet concrete without sticking my hand in it or writing my initials. But again, just the symbolism that we need to really make an intense effort, that this just doesn't happen, that we really have to work at this concrete change. Next slide. So what about this one? Is it true or false? The emergency operating plan is where you find the real details. How many think that's true?
You hope.
We have a bunch of false.
Yeah. Well, it is hopeful, but it is not true. It is not true. I mean, I probably have broken a Guinness Book of Records if somebody goes read more local and state plans, and with plenty of references to access and functional needs over the last 10 to 20 years, but it always refers to other documents. And the problem is, next slide, if they do exist, they are underneath. But often when I probe the underneath, they weren't really there either. So it's really important that we, in meeting with jurisdictions, emergency managers, look at, insist on seeing the details of the procedures, the policies, the practices, and the training. So in this slide, A is the plan, but they're in these thick notebooks. And I always say, well, that's the shelfware. And nobody looks at the shelfware during emergencies. What they look at, if we're lucky, is checklists, is job aids, quickly unpacking what needs to get done. And so B, these checklists are what is really critical. And they are underneath the ELP, the emergency plans. So the other lesson here is that, it's really easy to produce long lists of lessons from past emergencies, but it's not so easy and much more challenging to move to the long-term solutions and to work to create and operationalize and sustain the effort to get better outcomes. So that when we're looking for what's under those notebooks in the shelfware, we're looking for the details. And we either have to create them, maybe update them, but they've got to be specific. They've got to be the 5 W's. And they've got to address physical, equipment, programmatic, and communication access. So let's get a little more concrete. Let's take Pedro. Next slide. So Pedro's disability is quadriplegia due to a hit-and-run driver over 5 years ago. After hearing about a recent 10-day power outage in another state, he called his community-based organization contact to discuss his fears. If there's a power outage where he lives, he asked how would he survive? Because he uses lots of power-dependent equipment for his independence. A wheelchair, a breathing machine, a lift to get in and out of bed, an elevator to get in and out of his building, a remote front door opener, and a remote gate opener. And he does not have an emergency plan or a backup power plan, and he wants help with planning. He gets 40 hours a week of personal care and assistance with bathing, dressing, transferring, and meal preparation and cleaning. So examples and lessons to apply here are, how do we help Pedro? People like Pedro with their individual emergency plans. So next slide. One key lesson to apply that I've learned, at least the hard way, working with people, is that we need to start using scripts, thoughtfully constructed questions. Why? Because vague questions make for fuzzy plans. We've got to improve the focus on what's critical and the realistic details. And these scripts, these questions that are written, compensate for gaps in user experiences. Not all of us are stellar emergency planners. We have variable skills and unreliable memories. So, well, that would be you and me. So let's think about support roles that you all have. Next slide. These are roles that all of you in some way play a role in all of your diversity as the audience. So I'm going to address the ones in yellow right now and then go on to address the others. So helping Pedro with his emergency plan, doing this well and right, is actually pretty time consuming. It takes several meetings. Some of you have the needed knowledge and skills to know how to help Pedro with disability relevant and customized content for his plan that goes beyond the, what I call the vanilla, get a kit, make a plan, be informed, which is not enough for Pedro or other people with disabilities who have to plan for the nitty-gritty details linked to hearing, vision, mobility, speech, understanding, and remembering needs. So we're talking about the complexities like Pedro's needs. So clear and simple is often just not good enough. It's gotta be much more specific. So we gotta stop using these vague questions. It's not enough to ask Pedro, do you have help from family, friends, or support and care as needed? You need to start with scripts that ask Pedro, do you have a helper list? Also sometimes called a support network or support team. This is important for when Pedro's attendants don't or can't show up. There's got to be a specific list of people who agree to check on and, if needed, help are close by and can be quickly can get to Pedro. So incorporating slide 21. Okay, any guesses what this might mean? Yo, so Muma. Any guesses?
Nothing yet.
All right, well, if you click it, the answer will come up, I think. You're on your own, so map your mutual aid. You're on your own. Yo. You know, we all know that most emergency responders, at least 70% in major events, disasters, are neighbors and friends. So for all the Pedros, it's really important to map their helpers, and not just people who live across town, but it might need to be getting to know your neighbor. So stop using vague questions like, can you exit or evacuate your home? Start by using stronger questions like, can you exit your home without help or with help? Using each exit. Which exit needs power to use? A garage door, a gate, an elevator. Can you roll or walk to a vehicle? Can you transfer to a car from a mobility device? Do you have quick access to transportation? Can your mobility device break down and load into a vehicle space? And regarding alternative power, stop asking, do you have a backup plan? Start helping Pedros make and review a list of critical life supporting and life sustaining equipment and workable alternative sources of power. Ways to get by without power or backup power for each piece of essential equipment. For example, is there access to power generators or battery backup power stations, like, for example, Goal Zero, or neighbors who have built-in solar power and battery backup? I saw this great story on TV episode called 911. It's a major disaster, and the true to form, the local government, I think it was LA, was totally inundated and could not meet even a 10th of the calls coming into 911. And so a mother called and her child was on a vent, a breathing equipment, and could not survive for long without power. So the quick thinking young 911 operator Google Earth the neighborhood, found a neighbor about 5 houses away with solar panels on her roof. She called the neighbor, because I guess they had that data available, and the neighbor said, why are you calling me? I didn't call 911. And the operator explained, we have another neighbor down 5 houses down who is in dire need of power. Can they use, do you have solar battery backup? She said yes. And they proceeded to get other neighbors to string enough extension cords to the 5 houses to get that person and that child the power they needed to survive. I thought that was a pretty good lesson for a TV episode. Anyways, that kind of specificity, that kind of planning really helps to make these plans real. The next part is really thinking about contracts and memorandums of understandings and agreements with community organizations that emergency managers and public health can develop. So next slide. Well, we'll hold that slide. But anyways, why these contracts? Because organizations that focus and work with people with disabilities often understand the complexities and the nuances that are often minimized or viewed as minor by others, but are really major issues. So a reminder that all of these support roles and all of these questions I went over are in much greater detail in that health plan roadmap report back in the link on slide 4. So go back to the last slide, Anna.
Now you're testing me to go backwards, June.
It's the back arrow. It's the.
Oh, sorry.
It's okay. It's all right. Anyway, life safety checks done by community organizations can really help people get what they need, and also can, rather than relying on registries that don't work and are outdated before they're even created, to use disability organizations that have updated lists and can begin to contact and prioritize who to contact first that may be at highest risk during a no warning or short warning event, like Pedro, who lives alone and is dependent on attendance and who may need help evacuating from their home and their area. So really thinking about contracting with people, with organizations who know the community best and can offer the help needed to deliver what's needed, to use life safety checks, and to also help people avoid unnecessary institutionalization or inappropriate institutionalization that sometimes happens and is common, sometimes in big emergencies, but it's actually very inappropriate. It's very easy to be admitted to, for example, a nursing home, but it's very hard to get out once one is in a nursing home. And unfortunately, that happens all too often in emergencies. So next slide. So another role of community organizations is debris removal. You know, not the kind of debris that the local government or state government focuses on, which are major streets and highways, but the things that people forget about. The trees blocking accessible pathways that keep people from protecting their health and independence, that prevent people from who use mobility devices or can't leap over trees that are still bound from being able to access accessible pathways. That kind of debris removal. Next slide. So also another area that we emphasize is building online literacy and readiness, including telehealth readiness and assistance obtaining, using, and paying for necessary devices, and the connectivity. How do we help people develop and sustain for the long run ongoing online resilience? And last, how do we help people navigate the really complex and under-recognized lengthy system of disaster benefit recovery assistance? How do we? It takes mega time. It's very complicated. And these are systems that often don't well accommodate people with access and functional needs in terms of communication and housing and transportation. So we really need to start contracting with community organizations that can help people to navigate these complex recovery systems and mazes. I'll stop for a minute there. Anna, any questions in chat?
No questions.
No question. Okay, you go. Don't be shy. So next slide is a reminder about emergency communication content. Really looking at gaps in content, again, that go beyond make a kit, have a plan. The real nitty-gritty disability planning information that needs to be posted and available to people on government sites, on the Red Cross sites, on other VOAS sites, and that you all apply the accessibility standards and the building blocks to all of your social media channels so that people with hearing and visual limitations or loss can have equal access to the information and use of your multiple dissemination channels. Are they all accessible? And is the content relevant? So avoid things. I can't tell you the number of times I've seen content that is like this. The female website is posted as a resource. Well, that's like referring a layperson to not even being able to find a needle in a haystack. Like, what part of the female website? Like, be specific, be and annotate. Let people know what they will find in the link. Don't just use these generic links and hope that people will magically find what they need. Next area is one of my pet peeves, which is training. So next slide. Really have to start training teams and stop training individuals to really jumpstart the impact. When only one person gets trained from an organization and they go back to work, there's still only one person, trying to turn around the Titanic. It's better if the whole team from the organization gets trained. So you've all heard the information and you can all help to integrate and implement things you want to start doing or stop doing or change. The other is elevate the importance of exercises. People learn best when they're challenged to problem solve, not just given answers or presentations or webinars, but forced to struggle with the problem. That's when people really learn best. The other part is there's a lot of emphasis on one and done training in terms of, instead of kind of spaced and reinforced interval training and multiple ways to keep this on the front burner versus, one and done, check the box training. So it's kind of like drip irrigation. You just have to keep at it, drip, 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 drip. Keep it on the front burner. The other piece is, and this is my biggest piece, is more emphasis on just-in-time training. Because basically, and I've learned this the hard way, the people we train today, they're not there tomorrow. So emphasis on really good job aids, really good just-in-time information, really good checklist is where it's at, because there will be people who have never been a part of any of this training who are part of the response. And they're going to need really good just-in-time guidance. And last is, I think we have to stop using evaluations that only measure how good was the presenter, or how many right answers did people get to the pre and post test. We really have to start measuring, did performance change? Did behavior change? Was there an impact? What were the changes in the outcomes? So more on that point in the next slide is emphasis on really meaningful measures. We really have to struggle and think about evaluating what we do, our outcomes. How do we measure this? How do we test for the evidence of effectiveness? For example, maybe with individual plans, the increased number of people who have helper list as part of their plan, have a grab and go bag with specific content that meet their needs. Social media analytics. How much time are people spending on your social media channels? What documents are being downloaded? How many likes are there? How many shares are there? How many retweets are there? Do you use user surveys to find out, is this information helpful? Is it relevant? Is your worker performance competencies tested? Are there standards? And are lessons documented in post-emergency evaluations that get applied in subsequent emergencies, midterm and long-term? These are not easy questions, whether they're applied to FAST or our training or our social media channels. These are the things, I think, that really make the lessons more real. So, next slide. All of this may sound a bit overwhelming, but it's better to do something than nothing, to start somewhere. To take the small steps. And I think the jargon says it well. Start small, grab the low-hanging fruit, hit the softballs, make the small dents, and chip away at the objectives. Next slide. So you always say that disasters are always inclusive, but our planning and response and recovery is not, unless we embed and sustain it. So to sum this up, we need to apply the lessons so that someday we can claim them as lessons learned. Next slide. Next slide. We've got to really stop responsibility shifting. We can't say they should. We've got to start with we all should. We've got to start deepening and strengthening the bench. What are you going to do? What are you going to start doing? Post some of your stars in chat, or post some of your stops in chat. What are you going to start doing? What are you going to stop doing? What are you still confused about? Shift always happens, so there are, as we said, endless constraints. They're constant, so you just need to get a grip. You need to guard against the fade factor. And next slide. We need to keep this all on the front burner, prevent the silos. Again, it's not just Sherry who's going to do it, or Anna who's going to do it, or June is going to do it. We've got to embed that concrete change. And we have to attend to the details involved in supporting people's individual planning and provide really specific communication information and train teams, use drills, focus on just non-contact, and struggle to do all of this, or at least start to. So what do we have in chat, Anna, that we need to focus on so far?
This is Marcia, and no one has said anything. It's very, what you're saying is very interesting, and I've been taking a ton of notes, and I think probably everyone else has too. And I guess that, one question that I would have is, where can we find any existing examples of, like, the questions you were asking for folks, people with disabilities, to help them prepare? I wrote down a bunch of them, but I wonder if there are more.
Yeah, there are actually a lot more, and they are in the they're actually in that roadmap report. But there's a lot of details about helping people plan around things like have they register for your local alert and warnings, and do they working with them on their internet connectivity and their internet skills? Have they labeled all of their mobility devices? Have they thought about or put in place their alternative power plans to really think about and operationalize? Are they going to be able to use that generator or that goal zero power station on their own? Or are they going to need help to make that work? Have they tested it during sunny days? So they know what their own capabilities are. Do they have a communication plan, for example, with their helper list? What if the cell phone towers are down? Or can they text? Do they have a landline phone? Do they have all relevant emails?
June, this is Anna.
Yeah.
I'm going to interrupt and invite Susie from Team Rubicon. Put something in the chat. Susie, would you like to unmute? Share your thoughts?
Oh, certainly. Thank you. I just, as Julie is talking and as you were talking and as we learned in our exercises yesterday and this morning, communication is a huge part of this preparation, both in us as emergency preparedness minded people and the people we're trying to help. But that communication has to be two-way. We have to listen to them to understand their needs so we can then tailor back what we're training them on. And I think that really came across in this keynote really, really well.
You know, Susie, one of the things that people I don't think have thought about is the fact that people think that when the power is out, for example, that cell towers will just continue to function well for the duration of the power outage. I don't think that most people realize that cell towers also have battery backups, which are limited in hours. And so what is our plan when we can't use a cell phone or we can't text? You know, it's the old, you know, cave systems. What do we do before all this technology? And to think about, you know, who's going to run over and check on us if we can't run over to them? You know, they're looking not really smoke signal communication, but close to it.
That's so true. Thank you for sharing.
You know, I think you make the communication thing is a really important piece because part of it is good internet skills or, you know, owning a device and knowing how to use the device, getting technical support to learn how to use the device, and then paying for connectivity for the long term. You know, we have all these little COVID programs that help people pay for connectivity for 3 months or 2 months, but that's not good enough.
I'm going to call on Sherilyn. Sherilyn, I think you put a comment in the chat. Are there programs available to help? Why don't you unmute and pose your question for June?
Yes, thank you. I'm just wondering if there are any programs available to help assist people in obtaining backup power supplies, such as power packs or batteries. I've heard that PG&E might offer some assistance, but I haven't looked into it, but not researched it too much. So just wondering if you have any ideas on how to direct people to some resources.
Yes, I think Sherry Burns and your other local independent living centers will be a good resource because many of them have contracts with PG&E to work with people around their power backup needs and power needs in emergencies. That we've come a long way in California in helping people to plan for what they need with power stations or in short warning or no warning events when they can't use the power station to at least, you know, have gas to when they can get to a hotel or other location with power. So
Sherry, are you able to unmute and come on camera to answer Sherilyn's question?
Yeah, hi. Thanks for the question, Sherry Lynn. And June is absolutely right. I just put in the chat that the California Foundation for Independent Living Centers, which is our state membership hub for the 28 independent living centers in the state of California, operates several programs that support our residents with access and functional needs. And one of them is called Freedom Tech. It's a low interest loan program, and they provide loans for anywhere from $500 to $15,000 for assistive technology devices, which would include also backup portable power stations. There's also a couple of utility loan programs as well that do a similar kind of service where you could get a low interest loan or a discount. PG&E has a discount that they offer on portable power stations for those that qualify. And then, as June was mentioning, most of the Centers for Independent Living also are part of the Disability Disaster Access and Resource Program, or DDAR is what we call it. And we are DDAR centers. And we provide, and this is a partnership with the California Foundation for Independent Living Centers, the independent living centers across the state, and PG&E. And we provide loans of portable power stations. June had mentioned the Goal Zero Yetis, primarily the 3,000 units, but we also have smaller units as well. And for people who are in Tier 2 or Tier 3 areas of the state that often end up having public safety power shutoffs, or PSPS events, they can qualify for a loan of a portable battery to be, sent out to them, and they can keep it for as long as they need. It used to be that we had a certain time during the year that was considered PSPS season and fire season, and that tends to be now closer to year round, unfortunately. So when we loan out these power stations, they can stay with the family as long as they are still living in a Tier 2 or Tier 3 area, or experience multiple PSPS events in their area. And they have to have a need that they rely on power for their health and well-being, or to power their durable mobility equipment or assistive technology equipment. So that's a couple of resources that people can tap into.
And Sherry, I would add, maybe you can enhance this as well. There are some centers that work with the local cable companies to offer discount connectivity rates and devices to people who need, better online connectivity.
Yes, that's correct. And I could put that link. Also, it's a program that CFILC operates. It's called the Disability Inclusion Project. But also the federal government has resources available too now. They've been running a program for about a year, and a lot of people don't know about it. It's a $30 all-in access of internet service for a low-income family. So you do have to qualify under the HUD guidelines for a low income. And I will put that URL in the chat too. It's www.getinternet.gov.
Hey, Sherry, is that a time-limited program, or has that been expanded beyond a 3 month?
It's been expanded because a lot of people haven't been, they don't know about it and haven't signed up for it. So they're really trying to get the word out to let more people know that it's available. I don't know.
What I mean is it only for a 3 month period, or is it ongoing? In other words, the program was.
Oh, no, it's long term as far as I know. Yeah, I haven't looked at the details.
We need to check that, because that's a problem.
Yeah, my understanding was that it was long term, but I will put the URL in the chat. And let's see. Sherry Lynn asked with the City of San Jose, what is the CF stands for? California Foundation for Independent Living Centers, CFILC, California Foundation for Independent Living Centers. Okay, and I'll find the other URL for, besides the Freedom Tech, for their other program that I mentioned, the Digital Access Project.
Thank you, Sherry.
Mm-hmm.
Do we have any other questions from the group at this time?
This is Marcia. There was a question about senior presentations. Does anyone on the call know of any preparedness presentations for seniors?
This is Sherry again. Certainly within Santa Clara County, my organization, Silicon Valley Independent Living Center, does regular, ongoing monthly emergency preparedness workshops. For the last 2+ years, we've been doing them virtually. They're on, I'll put the link for the calendar of classes and workshops that we offer. But we do emergency preparedness for older adults. It's geared for older adults and people with disabilities, basically folks that are part of the AFN community. And those are absolutely free of charge. People can, just sign up for them and attend anytime. They are offered every single month. When we get back to doing in-person workshops, we will be offering them in person in our office again, as well as out in the community. We do some workshops within the City of San Jose Parks and Recreation Department at a couple of the senior centers periodically, but those are still on hold.
And Sherry, I would add that, correct me if I'm wrong, most centers that are offering the services we've talked about, they don't have a line that says seniors go somewhere else. Seniors are inclusive in everything that, for example, the DAR or CFILC programs are inclusive of people across the age range. But there are some specific senior programs related to building more online skills using the internet. I know AARP used to offer a lot of that, and there were some other programs that specifically focused on senior online skill building.
This is Cole. Ready.gov has a few large print brochures, maybe some other than English, that might be supplemental to the more local programs that I'm sure glad Sherry and her team have here. Really very, very useful thoughts and ideas here, June, and being thought provocative of really exploring more, getting specific, and not being vague hand wave kind of mindset. Thank you.
Thank you. Back to the original question about what needs to go in people's plans. We forget about having people really label all of their mobility equipment, just in case they get separated, with their phone numbers and their email addresses and their names, and just pictures of themselves using the device, and also the device's serial numbers and who the payer is, and health insurance cards, and just some of the important documents that you really need to have on the fly in major emergencies when power's out, for example, a long time and you can't access your contact list, or we forget about hard copies of, none of us know any phone numbers anymore. We just kind of go say, hey Siri, call Bob. So we forget that that's just not going to work in some of these events. So really doing the difficult thinking about what do we need hard copies of that we carry with us for communication. back to you, and I got a few more slides. If that would help, we go over the resource slides unless there are other questions.
Okay, what slide number would you like me to go for?
Just keep going. Okay, it's just a reminder that you know, to like move past the rhetoric and unpeel the layers of the details. It's what we've done here, and a reminder that we have to just keep doing it. Next slide. Yeah, I like this quote. You know, smart people learn from their mistakes. What the real sharp ones learn from the mistakes of others. I like that a lot. So none of these things are things that we cannot accomplish. We're all faced with a series of great opportunities, brilliantly disguised as impossible situations, which they are not. And this is just a reminder to, I'm not a fan of dogma, and dogma should come with a expiration date. So, and dogma, let me remind you, is when an organization says, this is the way we do it, period. Well, that way may need to be revised, changed, updated, or scrapped. Next slide. I think you may have covered this in a prior day, but this is like the CMIST explained and the link that you can access for that article. And again, this was a story in the CMIST. The original version was in 07, and then the dogma slide came out of, you know, I was the one that really invented CMIST, and so I would do a lot of training, and I would encounter people in my training that would say, oh no, you're not saying it right. This is what it stands for. And I said, what do you mean? I'm the one that created this, and this is the updated version. And they go, oh no, FEMA says it's this way. So that's where that dogma slide came from. You know, you gotta be careful to, you know, just because we said it in 07 one way doesn't mean we are not lifelong learners that can revise and update information. So Sherry, I mean, I'm gonna go back to that one slide. I'd like to remind people that in many ways, independence is the core of CMIST, and everything else communicates or contributes to independence, to maintaining independence. So it's really the hub of the spoke. Next slide. And again, a reminder that, you know, people with access to functional needs are often disproportionately impacted in these large emergencies. So although we all have functional needs, people with disabilities often have much more severe and much less forgiving needs that need to be addressed and planned for. And what else do we have? I think that's it.
I think that's pretty much it, June.
Okay, good. We got through all of them, and with minutes to spare.
Okay, I'm switching screens here. Bear with me, folks. Got multiple things up here. And in the meantime, Sherry has put in the chat box that SVILC offers emergency preparedness workshops on the second Wednesdays of the month. There's a link in your chat for more information on that. And Marcia, you want to talk about the AFN working group for a moment too?
I just put in the chat that CADRE has an AFN working group. They meet every month. And if you'd like more information about that group to be part of their discussions, just email admin@cadresv.org and we'll get you the information.
And with that, I think we're up to what's coming up next, and our most profuse thank you to June for joining us this morning, this afternoon, educating us, bringing us forward with our thought process and challenging us to take some next steps and really be action oriented with the information that we're working with and the discussions we're having this week. So thank you so much, June. We really appreciated and enjoyed your remarks this afternoon. What we have coming up for our final day of the symposium is day 3. We'll be doing another series of breakout session discussions tomorrow morning at 9, focused on recovery and the idea of the perfect pod or the perfect LAC. Pod is a point of distribution. LAC is a local assistance center. And so we'll be going forward on that. And then at 1 p.m. tomorrow, we'll wrap things up with our closing session. And with that, I think I'm going to launch our evaluation poll. And Marcia, if you would like to give any closing remarks, feel free. You should all see a Keynote evaluation poll pop up on your screen. Give us your thoughts, your feedback. And when you exit, there'll be an opportunity for you to also share any narrative remarks you'd like to share with us. Our objectives today were to learn from June Kailes, how to get it right before, during, and after disasters, and to inspire thoughtful reflection and actions, solution-oriented planning, and engage on the topic and our objectives for the symposium overall. So with that, I think we're ending just a handful of minutes early, but we're happy to stay on. If you want to unmute, if you have any further comments or questions, we're here for you.
Thank you, Anna. And we will be compiling a list of all of the resources. We'll share them at the closing session and post them online. So if you missed any, it's not your last chance. This was a great wrap up to today. June is amazing. I took so many notes, and now we just have to get started on making the changes here so that we can implement them. I love that visual of putting the procedures into the cement, putting your hand in the cement so that it doesn't matter who's in the position. They have the tools and the resources to do what others have spent time and effort and blood, sweat, and tears creating before they got there, which is one of our biggest challenges, is how do we not have all of that information disappear when someone's role changes? And I think we can do that here.
Wonderful. Thank you. And thank you again to our ASL interpreters, Rick and Sheila, as well, from Partners in Communication. And with that, I think we'll close out our session. See you in the morning.
Bye.
Bye-bye.